Okay, so I'm Jill Janisi, the student nurse practitioner. This is the Advanced Health Assessment course, Nursing 650. This is going to be an assessment of the skin and the abdomen. I have a patient here, Joseph Janisi. Do you give us consent to do the recording?
Yes, I do.
Okay, so prior to this video, I had already foamed in, washed my hands, performed hand hygiene. We had gone over his health history, surgical history, family history, but his chief complaint that he's presenting an illness with today is joint pain. He reported to me that he has joint pain in bilateral hips, bilateral knees, bilateral ankles. At this time, I don't think there's any issue, right?
No.
But sometimes he gets intermittent joint pain. The 7 attributes of that would be the location, which we discussed. He reported to me being a 6 out of a 10 pain using the pain numeric scale. He reports the pain being more of a dull pain. There's no manifestations with that. He's got no other symptoms of that. Usually it's exacerbated by physical exercise, his current job as a plumber, and thinks that this started in his early 20s due to his history of sports. So moving along to start the assessment, for the purpose of this video, we're just going to discuss and focus on the skin and abdomen. So I'm going to start by inspecting the skin. So I would look at any color abnormalities or variations. I'm looking for excessive dryness, any lesions, redness. I'm looking for moles. I'm checking skin turgor, elasticity, and the skin doesn't seem to be excessively oily or excessively dry. I'm looking for cyanosis in the lips, inside the mouth. It looks moist. The skin is of normal touch, assessing temperature. And I'll check more of the back when we move along further. I'm going to check the skin down here. I'm only going to go to knee length for the purpose of the video. Feel a little dry spot there. It's probably from maybe kneeling at work.
Yep.
I'm looking at the toes. No dry skin. Now I'm noting the big toenail to be smaller than average. And I already am aware of that from his health history. He reported to have previous ingrown nail procedures. Then I inspect the skin on the other leg. There's no dryness on that knee. So everything's looking pretty normal. And same thing on this big toe, a previous ingrown nail procedure. Now I'm just going to check out the nails. The nails look good. They're clean cut. Capillary return is less than 2 seconds. And I'll check these nail beds. I did want to make note of there's a scratch here on his forearm, but he reported that was from work. So there's no scarring or anything like that. So what I can do now is we're going to move on. I'm going to inspect his scalp. So first I'm going to look, and I can tell here that he has male pattern hair loss, and he's got the frontal line regression that looks like it's stemming from the crown. We have an alopecia spot here, but very, very fine hairs. Is there any tenderness when I do this?
No.
Palpating for tenderness?
No.
There's no pus. There's no growths, lesions. There's no redness. No scale, scaly skin. All right, so now I'm going to ask Joseph to, if he can scooch his legs over and lie down this way. So we're working with what we have here for equipment. And I'm going to take this blanket, which should be a sheet, and cover up the parts that I'm not examining. And we're going to actually do an abdominal exam. So I'm going to ask you if I can lift your shirt up. You can just lift it midway. So before I touch anything, I'm going to be, actually, I should turn this. So before I touch anything, I'm inspecting. I'm looking for asymmetry. I'm looking for pulsations, lesions, masses, anything abnormal, inspecting the umbilicus. And while I have him down, I'm going to check the skin up here. Still no redness, no lesions. After I inspect, I'm going to auscultate. So we split the abdomen into 4 quadrants: right upper, left lower, right lower. And I'm going to listen for some bowel sounds. Bowel sounds are all present. I'm going to listen in the aorta. I'm going to check all the arteries. Iliac, renal, femoral. Good. Everything seems normal so far. I'm going to actually start palpating. I'm doing a light palpate, looking for tenderness. Nothing is tender. Let me know if anything becomes tender. Percussion. We'll hear dull over the liver. Checking for any inflammation in the spleen, any tenderness. So now I'm going to deeply palpate, looking, feeling the liver, the border of the liver. Take a deep breath. So estimating the liver span, if I can feel about the 3rd costal rib to approximately the 5th. I'd say 7 centimeters, 7 or 8 centimeters approximately. No tenderness. Over here, checking for any kidney tenderness, spleen tenderness. bladder. So while I have you down here, I'm going to do a couple of the specialty techniques. This will let me know if you're having any appendix issues, appendicitis, or whatnot. So we're looking for McBurney's point, and that would be finding the umbilicus, and then the ASIS, which is the anterior superior iliac spine, which is about here. And then midline, or about 3/4. If I press really hard and there's no pain, okay. And then we're going to do the Rovsing sign. So the appendix is right lower quadrant. If I palpate here, where do you feel anything? Do you feel pain over here, or tenderness over here on the opposite side? No. And then if I do the if I put my hand above his right knee, I'll have you lift up. Any pain?
No.
No. This is the psoas sign, and the arbitrator sign next is I'm going to have you bend your right thigh in the air, and if I go out, any tenderness?
No.
Okay. And the last, we'll check for any cholecystitis. I'm going to have you taking a deep breath. And any pain?
No.
No. Okay. So I'm going to have you sit up. I'm going to continue to inspect the skin on your back. Again, looking for lesions, redness, symmetry, any abnormalities, pus, drainage, scaly skin, and I'm going to check for CV8 tenderness. So kidney is a little lower on the right side due to the liver. And tell me if you feel any pain or tenderness.
No. No.
And I'll check over here. Okay. So I think I covered everything for the skin and abdomen checklist. So that will conclude the skin and abdomen video.